beauties, what's up and welcome back to my channel. If you're new here, my name is Ngozi. I am a mom and a registered nurse working and living here in the UK. In this video, we're talking about what to expect as a healthcare assistant in the UK. So let's dive straight into it. No particular order. The first thing I'm going to be talking about is training. The company that employed you will offer you more training once you come to the UK, whether you got your job here in the UK or they are sponsoring your visa from overseas. Once you come in, your first few weeks is called induction, where you get to know the company, you read the company policies and procedure, and also they do what they call shadowing. During your shadowing, they pair you with a skilled staff or a mentor who will help show you the basics, like how to answer the buzzer, bed making, how to make fluid with thickener for those that are at high risk of choking. They show you a lot. Not counted as a member of staff that is actively working on the floor, but you are called upon to assist where you're competent to do so when needed. So all you need to do during this time is observe. Apart from your induction or orientation, you will equally get more training, which can be online or a tutor coming into your company to teach you, or sometimes it will require you to travel somewhere and go and learn. They will teach you things like dementia care, moving and handling, infection control. Just to mention, for you to know that your patients have the right to refuse treatment. Say for example, you go into your resident to assist them with personal care and they say no. There are a lot of factors to consider as relating to why patients decline care. One, it could be that they don't know you, they just need a familiar face, or they are tired, they are not ready for care, or they might even lack the capacity to make the right decision. Whatever the reasons are, I will recommend, if you find yourself in such situation, to leave the scene immediately and report back to your colleague or the nurse in charge, so that you all can brainstorm on the best way to approach that resident. So that if it's the case of them having a gender preference, then another staff can go in and continue with that personal care. Never find yourself trying to handle a resistant client all by yourself, or forcing care on any resident, because that is a breach of one fundamentals of care, which is consent. Patients must consent to treatment at all times. Meet a resistant patient, always have another staff present. Third is that documentation is highly important. I remember when I first started my job role as a care assistant, and then my manager will always say, if you did not document it, that means it never happened. So take for example, you started your shift around 8 a.m. and then there's a resident that is on repositioning for every 3 hours. You go in diligently to do your job, but then you forgot to write it down. And around 3 p.m. someone came in to do a supervision. My dear, you will get into trouble for that, because once they get to that room and nothing is being documented, it means you never did it. Okay, so as much as you are prioritizing to do your job, also focus on writing it down. All right. The fourth point is that you need to prepare your mind for long hours. The UK healthcare runs a rota-based system, but depending on where you work, you could get maybe a long day or a half day or a mixture of both. So for the long day, it can be either a day shift or a night shift. These two shifts are 12-hour shifts. It starts for day shift in the morning, maybe around 7:30 or 8 o'clock to in the night. Okay, and same applies to night shifts. For the half day, you might be expected to start maybe in the morning and finish late afternoon, or start late afternoon and finish in the night. Okay, that varies from each company to another. And sometimes if you're working in support work, you might be expected to just come in and assist the residents or the clients get ready for daycare. Once they go for their daycare, you are allowed to go home. So I've worked in a place where I come in the morning around 8 and start my shift till 11 o'clock. When they go for daycare, I'll have to go home and come back 3 p.m. If you're into home care, that one you have to go from one home to another to support them with what they need. So do well to find the working pattern the company that is recruiting you is using, or you sign your contract. The next point is that there could be time you will be expected to stay longer than required. Although I have mentioned that they work a rota-based system, but say in incident like someone is coming late, or there's an emergency, maybe someone going to the hospital, or someone has fallen, when it's about 5 or 10 minutes for you to finish your shift, situations like that will warrant you to stay a little bit longer. The good thing is that your company will pay you for any extra hours you stay for emergency. The sixth point is for you to know how to work with others to achieve a common goal. You know what you wrote on your CV, that you are a good team player. It is really needed in care job, okay? So if you're the kind of person that don't like to take instruction, you don't like anyone to tell you what to do, you always want to be in charge, you know, then care job is not for you. Because when it comes to care job, is a teamwork. It needs a lot of collaboration, a lot of liaising with other professionals to give your patient the best care they need. Next is for you to do all your prayers at home. Don't go into your workplace and start preaching or praying for your resident. That could be tagged harassment.
Manager called me to the office, and it was a very casual, less than 2 minutes call chat. Sat on the desk and said to me that there had been complaints from patients regarding me talking about my religion. It wasn't fair that I was sacked.
Don't let that happen to you, okay? If you got value from this video, please support me by subscribing to my channel. Also share it with your friends, and thank you so much for watching this video. I will see you in my next one. Take care. Bye.